Typhoid fever.
Typhoid fever.
Typhoid fever.
Typhoid fever.
Typhoid fever.
Typhoid fever, aka the weakness fever, can have symptoms that include high fever, headaches, belly pain, either constipation or diarrhea. Signs of typhoid fever include headache, muscle weakness, rash with small red dots, or weight loss. Areas of pain for typhoid fever are the abdomen and muscles. Typhoid fever affects children younger than 15 years and accounts for 55.9% of typhoid fever cases, with the disease being most common among children between the ages of 5 and 9. Typhoid fever targets children in populations lacking access to safe drinking water and adequate sanitation.
Typhoid fever is a life-threatening infection caused by the bacterium Salmonella typhi. It is usually spread through contaminated food or water. Salmonella typhi, or most commonly known as typhoid fever, is shed in the urine or stool of infected people. It can be transmitted by direct or indirect contact.
Hi. Treatments for typhoid fever consist of fluids and antibiotics. Some supportive care methods are IV fluids and oral rehydration fluid. The vaccine for typhoid fever is a life virus vaccine, which means that scientists have found a virus that can co-combat the infected parts of your body. The first-line antibiotics that act as a treatment are chloramphenicol, ampicillin, and quatrum oxazole, while the multi-drug MDR has been used since the 1970s. The areas affected are your lymph nodes, gallbladder, liver, and spleen. Some carriers keep releasing typhoid even after years of being treated. To fully recover from typhoid fever, it will take 3 weeks or longer.
Typhoid fever is spread through contaminated water and food. It is also transmitted from person-to-person contact. It can also be spread from people's contaminated bedclothes. It can also be transmitted from using a toilet with contaminated bacteria and touching your mouth before washing your hands. Also, it can be spread from eating raw vegetables that have been fertilized by human waste. It can also be transmitted in many ways. People of the Renaissance were in great danger.
Typhoid fever is spread by eating or drinking contaminated food or water. It can also be spread by direct or indirect contact from person to person with someone who has typhoid fever. The most common places where typhoid fever can be found is where the food and water is unsafe to drink. It can also be found in contaminated places and unsafe areas. It can be spread by people if they don't wash their hands after using the bathroom. There are 125 people that are affected by typhoid fever.